Hi, my name is Maggie Thiessen, and I'm in my fourth year of kinesiology. And today I'm looking at the injury of a university level volleyball athlete. Before the competition starts, I would check the court for malfunctions or possible safety hazards, like checking the net and surrounding area. Athletes should also do a pre screening and make sure they have proper equipment on. The emergency supplies needed would be biohazard management equipment, access to stretchers like a scoop stretcher, C-spine collar and spine board, splints, slings, crutches, tape, bandages, immobilizers, and then water, ice, and towels, and a table to assess players on as well needed. U Sport and the Canadian Red Cross actually require this equipment to be available for a non-contact sport event. And having students' medical history, emergency contact information, and knowing where the nearest hospital is would also be important in case of emergency. For PAC specific safety, the AED is on the first floor by the help desk, which is just outside the doors of the PAC gym. There is also an EMS emergency vehicle access at the rear of the PAC gym, and the main entrance elevator at the front of the PAC would also be a good access point. For crowd control, the charge person would make sure others are kept at a safe distance from the injured player to leave enough room for the emergency first aid. The roles of the first responder or charge is to manage the scene and assess the athlete. The call person contacts emergency services and communicates for the EMS in charge. And the control keeps others at a safe distance and brings supplies, so a person trained in first aid would be assigned to that role. During the athlete's vertical jump, there was a sudden lengthening and overloading of muscle in her left leg, so we can tell that the mechanism of injury was a tension force that resulted in a sprain. Based on the video, I would say the sprain is a grade 1 ACL sprain because of vertical jump and the ability to partially weight bear. To manage the scene, the student trainer in the charge position would first, in the primary scene, check airway, breathing, circulation, and deadly breathing. In the secondary scene, I would check for shock, the area of injury for bleeding or fractures, to see if they can weight bear, and to see if the athlete could move without causing damage. Here, in this scenario, the emergency action plan does not need to be activated. Because she was able to put partial weight on the knee in a human crutch technique, she should come off the court to the assessment table. And from the video, I don't think she'd be able to bear weight without the help from others, so I would use a splint to immobilize the knee and give her crutches to move safely on her own. Rest, ice, compression, and elevation is important for a grade 1 sprain to help inflammation. After the acute care, the athlete should still see a medical professional for a proper diagnosis and get imaging done, but she does not need an EMS. Seeing a physiotherapist would also ensure she's recovering safely, properly, and efficiently. Because this is a grade 1 injury, she should experience swelling, discoloration, joint instability, and pain on the back and outside of the knee for a few weeks until completely healed. When she plays again, I would recommend a knee brace or taping up the knee to give it more stability. She should also continue to see a physiotherapist to continue improving stability. Thank you.